Happy Friday, Baylor College of Medicine and friends of Baylor. Well, it's been a wonderful week of Omicron. I can't wait to have a big discussion about it. Let's look at the world map. It's no longer just in South Africa. It's also in Namibia and Zimbabwe. So most of South Africa is sort of on a surge again. If you look at what's happening in the world today, Germany has joined Austria in really clamping down on people who aren't vaccinated. And so if you don't have proof of vaccination or you can't show that you've recovered from a recent infection, you can't go out in public or hang out with your friends, which is, it's probably the right thing to do. It's now, Omicron is in 30 countries. It's in over half the states in the United States. So it's spreading. In Britain, the number of cases climbed to 336, twice the number before. In Denmark, it's up to over a couple hundred cases. Again, not a huge amount, but beginning to show its increase. And if you look at just COVID in general, COVID diagnosis in general, Europe is still the hot spot with the United States and Canada behind. Obviously, South Africa is on the rise again. So what is going on in South Africa, and why would we focus on South Africa? Let me show you. This is Omicron. That's South Africa. So while it's coming up in other countries, it is just dominating in South Africa. It's spreading faster than ever there. Now, there's some indications that while it's very infectious and contagious and spreads fast, it may not be as serious in terms of causing serious disease. And there have been a couple of reports that suggest this. One major hospital complex in Tshwane, formerly Pretoria, has said, the patients they were bringing in the hospital seem to be less sick. Many of them have been diagnosed just on admission for other procedures, so they weren't admitted for coronavirus symptoms, but were found to have Omicron when they were tested. And in fact, if you look at the South African overall positivity, it was just hanging around low at about 2%, is now up to 25%. So as people come to the hospital, 25% of the tests are coming out positive, even in patients who were asymptomatic or admitted for other reasons. Now, if you look at sort of on the positive side, I'm always looking, you got to find something positive or my sister goes crazy for the week. So I have to say, Janet, there's some positive. The spike is impressive. This is the spike of new cases in South Africa. Incredible. But if you look at mortality numbers, we talked about this last week. Mortality usually follows by a couple, 2 to 4 weeks after the spike. It hadn't budged. And so that is the strongest evidence that we have so far that the Omicron variant, while more infectious, may not be cause a severe illness. So a lot of interesting studies. Very large South African health insurer looked at 211,000 coronavirus cases, and 78,000 of them were attributed to Omicron. But the risk of hospitalization was 29% lower than before. And so that's one fairly large study that suggests that while it's rampant and spreading, the risk of hospitalization is less. There was a study in Tshwane that looked at 166 patients, much smaller, but they found that the average length of stay for patients admitted was only 2.5 days versus in the past 8.5 days, their mortality had dropped from 17% to 7%. Again, another smaller study, but evidence that it is less serious, less virulent. The only other issue that is, to think about is, well, why, are there reasons other than less virulence that could account for the, reduced severity? And you have to think about, what kind of patients are being infected. And it's been 2 years into the pandemic, so a lot of people there have been infected and recovered. And while South Africa is relatively low in vaccination rate, the people who have been vaccinated are older. And so you got a population that is not completely naive. It's a lot of people who have been infected and recovered, and a lot of older people who have been vaccinated. So this appearance that it's less virulent may just be because there's more vaccination in the older group and that the people that are being admitted are younger. So it's really hard at this point to know just yet whether or not the whole issue of virulence is important. It looks like it, but we just don't know yet. Now, there was one really good study from the UK on vaccination status, and this is sort of the best data looking at whether or not the vaccines work. So we have there are two studies here. One is AstraZeneca vaccine with a booster from Pfizer, and then Pfizer vaccine and a booster from Pfizer. And the evidence shows that for Delta, it was quite, Pfizer was very effective, even though it dropped down to a low of 60%. A booster for Delta brought efficacy back to over 90%. But Omicron, what you can see is it drops after 2 vaccinations, dropped to less than 40% effective. But with a booster, brings it back up to almost 80%. So, and with AstraZeneca, it was almost of no value against Omicron, but with the booster, with the Pfizer booster, brought it up to about 70%. So the good news is that 2 shots of Pfizer or AstraZeneca plus a booster of Pfizer brings it back up to 75 to 78% effective against Omicron. The bad news is 2 shots, not so much. So, this is it just means a lot more people need to get vaccinated. And what you can see is the United States is kind of lagging behind others in vaccination. So, this is really the most important work. There was also a study in Britain that showed very similar. 2 doses of the vaccine offers protection initially, but drops down to below 40%. Again, a British study. And then if you get a 3rd vaccination, a booster shot, it was very, very effective. The good news for both, though, is that while the efficacy of preventing any kind of symptomatic infection drops to 40%, the hospitalization rate stayed pretty good. It's almost 70% effective against getting hospitalized or serious illness. So again, this speaks to the fact that looking just at neutralizing antibodies alone isn't the only thing. So while you can get symptomatic infection, the chances of dying from the disease is much less if you're vaccinated. But if you get a booster, even getting symptomatic infection is very low. So very positive news that vaccination with Pfizer or Moderna and a booster with Pfizer is very, very effective against Omicron. So what's going on in the United States? Well, we're back into another surge, 120,000 cases daily this past week. Mostly driven by the Northeast and the Great Lakes states. New Hampshire leads the country in recent cases per capita and has the most hospitalizations. I like to pick on New Hampshire because they are the live free or die state, and they don't get vaccinated because they want to live free. Well, they're now leading in cases per capita and hospitalizations. It's your choice, live free or die. I guess it's your choice. Michigan has some of the highest rates of hospitalization. In fact, the feds are sending in support teams. It's sort of surprising. New Mexico is having a little bit of an outbreak, as is Arizona. And for the first time, unfortunately, we have now passed 800,000 deaths in the United States, which is just really tragic, as only 60% of the United States population is vaccinated. Here's a hot map. You can see the hot areas are where the new cases are. New Mexico, Arizona, and then Great Lake and Northeast. And then, this is the sort of the curve. You can see the 4th curve. I have superimposed the Paul Klotman curve of hope. I'm making it up, but I'm hoping it's right now there. I'm hoping it'll peak here. I don't know. I think it's unlikely. We're 72% of folks have at least 1 dose vaccinated. 60% 2 doses. Forget the curve of hope. The curve of reality is probably what IHME, the Institute for Health Metrics and Evaluation, is projecting, that we won't peak until late January, and we won't start coming down until February. That is not the curve of hope. That's the curve of reality, unfortunately. Well, here in Texas, we're not doing so bad. It goes in waves. So, we were doing terribly in the beginning. We're doing better now. I'm worried we'll be terrible soon. But good news, our friends in Nibby County, God love them, they are now ahead of us. So they are now considered a low-risk community, whereas Harris County is down to moderate risk. Oh, those javelinas, they're better at following directions to people. They have the highest vaccination rate of any pecorine. I just made that up. I don't know if that's true. So what about in the Texas Medical Center? I was so excited last week because we were down at 232 cases per day, and I said I was worried it might be Thanksgiving holiday mixer. Well, We're back up to 721 cases per day. That's a lot. That's too many. I think the right number to feel comfortable here is less than 200. And, you know, the only good news is the hospitalizations didn't jump up, but they're going up. So modest, but they're going in the wrong direction. But what about Omicron in the United States? It's all over. 30 cases, 30 states. This whole concept that travel restrictions are going to do anything is ridiculous. It's already everywhere, so I don't even know why we're bothering with that. But one of the most interesting things is data from the CDC. You know, we weren't really seeing a lot of Omicron. Well, it has jumped up to 3% of cases. You can begin to see, and we just don't know. It may well emerge as a dominant strain, unfortunately, but we'll have to wait and see. It is really competing against Delta pretty aggressively in New York State. That's the highest percentage. 13% of the sequences are Omicron, which is odd for me because if you think about it, the Northeast and particularly New York, New Jersey, Connecticut, those have been some of the higher vaccination rates, but where it's really high in that region is in upstate New York, where the vaccination rates aren't that low. And in fact, it's so high, Cornell in Ithaca, look at this peak, this spike of their students. I mean, they had to close the campus down. And it's not from faculty and staff, it's mostly students from that region. So it looks like upstate New York is sort of the hot spot for Omicron. It's the closest thing we have to South Africa. But, you know, we're not without tools to fight this. I remind people, vaccines work. Now, unfortunately, it may take 3 shots, but vaccines work. Masks work. You know, masks works. And we have tests that still are able to detect any of the coronaviruses, including Omicron. So, you know, if you're concerned, get tested. You know, if you're symptomatic, stay home. Wear masks where you don't know vaccination status in public. Get vaccinated. These are you know, obvious things to do, and some places do it. I bring back our friends in Japan. Remember the Olympics? The prime minister resigns, and all of a sudden it's not there anymore. Why? They're over 75% vaccinated in the country, and everybody's wearing a mask. So it's not like we're totally without, you know, ability to deal with this. There was some interesting science that I'll briefly review for Omicron. So there've been a lot of structural modeling of all the changes in the spike protein, and it looks like these changes make it more likely to bind tightly to the ACE2 receptor. That's the receptor that's responsible for bringing the virus into cells. Because it binds so tightly, it may be that the antibodies that are directed to it are not able to interfere as well. So that's one thing. There's some models that suggest that Omicron will take over the pandemic in the winter and will become the dominant strain. We don't know. The good news, as I mentioned, 3 doses of vaccine work. And then the other thing is I want to remind people that no matter what, even with 2 doses, yeah, people are getting symptomatic infections, but they're not dying. They're being hospitalized less often. And so we have not spent enough time talking about T cells and the role that they play in memory and being able to respond to all different types of coronaviruses. And there's a lot of work going on in that area. And so, you know, there are other epitopes besides the spike protein. There's this S2 part of the spike protein. There's the polymerase. There's the nucleocapsid. There's a lot of areas that we could be testing for more effective vaccines. And all that work is going on, and of course we will keep you up to date. And now for my favorite part of the week, best and worst news of the week. Well, the best news by far was the Pfizer high-risk trial of Paxlovid. I mean, unbelievably effective. 90% effective in reducing hospitalizations and death, and 94% effective in those over 65. Showed a tremendous ability to inhibit viral replication. Remember, this is a protease inhibitor. 10-fold reduction in viral load. Hugely effective. And even within, as long as you start within 3 to 5 days of symptoms. So I am certain that will get approved very soon, and it should be in a pharmacy near you. So hopefully it'll be like Tamiflu. If you're feeling symptomatic, you just run to the store and the pharmacy and take it. Worst news of the week, Merck. You know, for a while they thought in the first trial it was 50% effective. This is the polymerase. This is a polymerase inhibitor, but it causes mutations in the polymerase. not only in the larger trial was it not 50%, it's actually down to 30%. So it'll get approved, but I'm taking the Pfizer one. I'm not taking the Merck one. I want to end this week with a couple of shout-outs. First of all, the wife of our chair of dermatology, Brandy Wolf, made the single coolest ornament of the holiday season. This is something to hang on your tree. It is a face mask to be worn at all times when you're around your tree. The second thing I want to do a shout out for is the Baylor calendar with art that was from the art show hosted by the Graduate School Student Council. Beautiful artwork that is generally, it was done by our local artists, and of course prominent in that is a photograph by yours truly of a place where when Lily and I walk on North Boulevard. You can get this in your calendar by simply writing the president at bcm.edu. We will send you a calendar. Now, it's not like a New York fireman calendar, but, you know, it's nothing as good as that. But this is second best. Also, I want to, where's Miss Lily? Miss Lily participated this week in the ugly sweater contest. And she went this year as an elf. There you go. Now, I'm not sure if she's going to win, but she certainly deserves at least honorable mention. So listen, have a great weekend, and I can't wait to see you next week.